Welcome back to FAMWISE. We are on lesson number 9 in biomarkers, all about LH testing. Let's get into it. So what is LH testing, or those OPKs? So OPK stands for Ovulation Predictor Kit, and LH testing is basically testing for the hormone LH. So LH, again, is your luteinizing hormone, can be used as a secondary biomarker, and it typically rises 24 to 36 hours before ovulation and can be detected in urine, saliva, and blood. LH can help us determine ovulation more precisely by indicating approaching ovulation. So why should we actually use LH strips? It can be helpful in confusing cycles, and it can also help us provide more confidence in our primary biomarkers. So you don't have to use these test strips, but you certainly can if you like. So you can find LH test strips really anywhere at like the drugstore. You can find them online, Amazon. They're really easy to come by. If you were at like your drugstore, you would just find it in the same aisle as the pregnancy tests. And yes, these are different than pregnancy tests because pregnancy tests test for the hormone HCG. LH tests test for the hormone LH. So when do you actually start to test using these strips? You're going to start testing at your point of change or on day 7 if your biomarkers are unclear. And be sure to mark this on the chart the days that you do test with either a positive sign or a negative sign in your notes section. So once you get a positive test, you're going to write LH positive and then plus a count of 4 days. So when we get our positive LH test, we do the count of 4 days, just like we do peak plus 3. But because the LH is rising prior to ovulation, remember it's going to rise 24 to 36 hours prior to ovulating. That's why we add a count of 4 days. And that will cover the release of the egg and then the egg disintegrating past that 24-hour point. And this is how to actually read your LH test kit. So there will be instructions on like whatever test kit you get, but just to help to make it a bit more clear, I'll explain it here. And I've also attached some instructions to the extra like documents in your course section as well. So for a positive LH surge, the test band is going to be equal in color or greater in color than the control band. So you can see on the picture on the right how the farthest one to the right, we have a positive. So like the control line is the first top line there. The bottom one is darker than that control line, so that is a positive. In the one next to it on the left, both of the colors are equal, so the test line matches the control line. That is also going to be a positive. For the negative tests, either there's going to be no color from the test line to the control line, so that first one there on the left, that's a negative, or it's just the control. That's what it's going to look like when you take it out. And then the one next to it is also a negative because the test line is lighter than the control band. So that's going to be a negative. If there's an invalid response, you're going to see no control band appear within 10 minutes. So let's say that you started taking your LH test or your OPKs on day 7 of your cycle or at your point of change, and eventually you get a positive. So once you get that positive, ovulation is going to occur 24 to 36 hours after that LH surge and within 3 days on either side of peak day. So let's say that you tested positive your LH that day before peak day with the star. Ovulation is going to occur within 4 days there. So that's why we do that count of 1, 2, 3, 4. And then peak day, we also have peak plus 3. So within that time frame, that's the estimated time of ovulation. Now, a key note here, just because you get a positive LH test does not mean that you are actually going to ovulate. If you get that positive LH test or positive OPK, that does not identify the POC. So that does not identify your point of change, and that is not the start of your fertile window. Likely your fertile window started before that point. And it also does not confirm that ovulation did or will take place. What it does do is give you an idea that fertility is high and ovulation is likely approaching within the next 24 to 36 hours. The LH surges due to the mature follicle releasing estrogen, and that swift rise in estrogen is going to launch LH from the brain, and that is what is coming up on your test. And just because the LH rose doesn't mean that it actually released the egg from the follicle. So it might have not, and you may not have actually ovulated. That is why we can't just rely on LH tests to confirm if ovulation has taken place, because we really don't know if it actually occurred. It's just indicating that it might occur. The same thing that like we can't just rely on that to prevent pregnancy, because likely our fertile window is going to be before you even test positive for that LH. That cervical mucus can keep sperm alive up to 5 days. So that's going to be before that. Here are some reasons why you might get a false positive LH surge. So you get that positive, but it's actually inaccurate. Maybe you're misreading the test. PCOS can also cause elevated LH levels, which can lead to frequent false positives. Perimenopause with the hormone fluctuations during that phase of life may result in higher LH as well. Pregnancy and elevated HCG hormone can sometimes be misread by ovulation tests as LH. Certain types of cysts can also cause elevated LH levels, and then different medications as well, like fertility drugs or hormone therapies, birth control, or Plan Bs, can also mess with your LH as well. Do you take the test too early or too late? So if you take it too early, you just might not be at that LH threshold yet, so just keep on taking it. If you're taking it too late, maybe you missed your LH surge already and it already occurred. Also, approximately 15% of women experience LH surges that do not reach the threshold detectable by ovulation tests, so therefore may never see a positive, and this really depends on the specific test that that person is using as well. So even though they are getting an LH spike and they are actually ovulating, it never comes up on a test. So that's a possibility as well. Let's just go over a few questions and review of what LH is actually doing. So what does the LH surge indicate? So that indicates that the ovulation will likely occur within 24 to 36 hours. And what day would LH testing begin on this chart? So if you look on the bottom there, what day would LH test begin? That would be day 11, because that is our POC, or our point of change. And we would test up until we get that positive. And you see how we got a positive on day 15. Then we do our count of 4 days ending on the 19th. So then what day would we discontinue the testing? Once a positive reading is noted, you're welcome to do one more day after that, but once that is noted, you can discontinue. If the LH surge is on day 15, when is the last day of fertility for this chart? That would be day 19, because the LH rises to a peak and maintains a plateau for several hours. And then we have LH plus 4, which covers the time of the plateau and then 24-hour lifespan of the egg. So we would deem ourselves infertile from day 20 until day 30.